Welcome. And if you weren't on the previous session, this is the Friday Focus for Health, and it's hosted by Great Plains Quality Innovation Network, which is the Centers for Medicare and Medicaid Services Quality Innovation Network Quality Improvement Organization for North and South Dakota. I'm Dee Kazer, and joining me today is Katie Burkett. We are both quality improvement advisors, and Kelsey and Carrie of our communications team. We want to thank you for joining us today for our fourth and final week in this series. The webinar is being recorded. It'll be posted in 1 to 2 business days on our website at Great Plains with an S, QIN.org under the Friday Focus for Health page. We'll have the same format as we have been having, where we'll have an educational presentation, and then we'll do office hours for the second half of the call. But at any time, you can add questions to the chat and we will address them. And Kelsey will be adding a resource document into the chat if she hasn't already. And that resource document includes all resources shared during today's session and the prior 3 weeks of this series. All right. We would really like your feedback on these weekly Friday Focus for Health sessions and any ideas on future Fridays Focus for Health. We are sharing this QR code that you can see on the screen. Use your camera on your smartphone, or you can go to the link that'll be put in chat. We really would love for you to open these up and be ready to provide us feedback at the end of today's session. As always, we want to keep the age-friendly principles in mind whenever you initiate or implement a quality improvement project. And the framework of that is what matters, medications, mentation, and mobility. And of course, you want to align your care to what matters most. All right. Last week, Katie talked about how to take a blood pressure correctly to ensure accuracy, and shared a printable resource that I will share again that you can use in your office or give to patients to take home. But one of the most important aspects of self-measured blood pressure is ensuring that your patients are taking their blood pressures accurately. But even more important is that medical professionals take blood pressures correctly. Medical professionals demonstrating accuracy helps to reinforce what we are asking patients to do when they're performing their SMBP monitoring at home. And so for the rest of the presentation, you're going to hear me use the acronym SMBP for self-measured blood pressure, just because it's a little less of a mouthful to say. So I have a video that I really would like to play here, but I do want you to keep in mind that your organization may be using an automated blood pressure machine, and that's fine, but you need to be consistent with what is being used, and of course document in their medical record how it was taken. Was it manually or was it automated? And then empower your patients to tell you which way their blood pressure has previously been taken when they come into the clinic or in the nursing home setting or wherever they might be, so that there is consistency. So we're going to go ahead and watch this video. Hopefully I've got everything set up so that you can hear it. Let me know if you can't.
Studies indicate that the #1 barrier for clinicians taking accurate blood pressure measurement is time.
Because I need to check your blood pressure and it can affect the results, I need to know if you've consumed caffeine or smoked in the last 30 minutes. No, I have not. Also, having a full bladder can increase your blood pressure, so if you need to use the restroom, I can show you where that is now. Then I'll let you relax here and be back in about 5 minutes.
One of the biggest mistakes that we make in healthcare is not letting the patient relax quietly for at least 5 minutes prior to taking their blood pressure. The clinician will need a stethoscope, a calibrated sphygmomanometer, and the appropriate size blood pressure cuff. Choosing the right size cuff for the patient is another area in which errors are commonly made. The clinician will take care to assure that the patient is positioned correctly. Their legs should be uncrossed, their back supported, and their feet on a firm surface. The patient should also expose their bare arm. The arm should be supported at the level of the heart. The clinician will apply an appropriately sized blood pressure cuff to the patient. This cuff should be long enough to encircle 80% of the arm and wide enough to cover 40% at midpoint. A cuff that's too small may add 2 to 10 millimeters of mercury, and a cuff that is too large may underestimate the blood pressure. Appropriate placement is indicated with the use of the index line. The cuff should be placed 2 finger widths above the antecubital fossa to allow for placement of the stethoscope. To take the patient's blood pressure, the clinician will palpate the patient's radial pulse while inflating the cuff and noting when the radial pulse is obliterated. The clinician will inflate the cuff to approximately 30 millimeters of mercury higher than the point of pulse obliteration. The clinician will then move the stethoscope over the brachial artery and will auscultate with the bell or the diaphragm. However, the bell is recommended for low-pitched sounds such as the Kurot cough sounds. The clinician will release pressure at the rate of 3 millimeters of mercury per second. They will take note of the first audible sound, known as Kurot cough 1, or the systolic value, and the disappearance of those sounds, known as Kurot cough 5, or the diastolic value. The clinician will read the blood pressure to the nearest 2 millimeters of mercury and document those findings accordingly. Even under optimal conditions, patients may have anxiety about being at the clinic or seeing the provider. This condition is known as white coat syndrome, and this can raise a patient's blood pressure up to 30 millimeters of mercury. This completes the process of accurate blood pressure measurement.
Okay. So there's a lot of things and a lot of tips in there that I can honestly say I probably don't do when I've taken blood pressures and haven't been done for me when a blood pressure's been taken. So I think we can all learn something from reviewing that video and seeing how we really should be taking them accurately. All right, so what I want to talk about today is how do you as an organization implement SMBP? And Target BP, which Katie talked about last week, has a wonderful resource. It's called the Target BP Self-Measured Blood Pressure Quick Start Guide, and it consists of 5 steps. I want to show you the Quick Start Guide. You have to bear with me. Device patient. There we go. So this is the self-measured blood pressure quick start guide. And as you can see, there are 5 distinct sections in this, and we're going to go over these 5 areas or these 5 steps as we go through the rest of the presentation. Okay. All right, so step 1 is assess how your healthcare organization currently uses or wants to use SMBP. You might already be using it and want to just beef it up a little bit, or you're thinking, yeah, this is something I'd probably like to do. So they've included in the quick guide a pre-assessment tool. And I know sometimes we hear about these tools and we think, oh my goodness, is this going to be 20 pages worth of going through things? It's not. It's 1 page. It's very quick, and it just talks about what is included in your office workflow for SMBP. How are you going to identify patients, train your staff, train your patients? Are you going to recommend automated upper arm SMBP devices? What's available in your area? How are you going to act on the results that you get? How are your patients going to get those results to you? And, just all the training that goes into being able to do this. So it's not as scary as it seems when we talk about all these different tools. So then step 2 is build your healthcare organization's knowledge in SMBP. And they provide 3 very nice resources here. The Target BP provides an informative video that defines SMBP. It reviews key considerations before using it with your patients and provides tools and resources that will aid in effective implementation. They also have a library of on-demand webinars to help you practice and improve blood pressure control for all of your patients. And those resources include interactive tools, face sheets, podcasts, webinars, and videos, along with handouts that you can give your patients. And last but definitely not least is the CPT Code One Pager, which is an overview of CPT codes for providers to use with SMBP clinical services. So to answer your question, yes, SMBP is a billable service, and getting started with it is easy, and you can generate some revenue along with doing it. Okay. So step 3 is consider developing an SMBP loaner device program. That's completely optional. But if you're in an area where cost is prohibitive to some of your patients for getting a automated blood pressure cuff, or you just don't have them available, you might want to consider buying a few, loaning them out. And step 3 gives you some worksheets that you can use to keep track of your inventory of where they're at and who has them. And there's also a device agreement, just stating very basically that it was given to this person on this day and that they'll try in good faith to keep it from becoming damaged. Step 4 is a list of a lot of different resources that are available for your patients. They help to train the patients on the proper SMBP techniques, and there's also an average SMBP measurements for provider interpretation. So I'm going to show you just a few of these. So here we go. The self-measured blood pressure patient training checklist. What should be you should train your patients on. It's very quick and easy to do to make sure that your patients have been trained on what they need to do. This is the device accuracy test that you might want to use when they bring in their monitors, so that you know that they are accurate. It's very quick and easy to go through. There's also this SMBP average calculator, and I think this is one of the best tools that's in here because I like things that are quick and easy. And this is taking all of their blood pressures, their morning readings, their evening readings. You just slip them in to the spots and it automatically gives you an average of what their blood pressures have been over a certain length of time. So I think it's a really nice tool to use. It's nice to have that filled out and ready for your providers when patients come in for a checkup or an exam, and you can just have that average right there for them. Okay. On the next step, it's set your patients up for success with resources to educate. There are 4 really good resources that are on here. You've got what is SMBP, the SMP infographic, a training video, and the recording log. So I just want to show you a couple of these. That SMBP infographic is the same one that Katie shared with you last week, but this one is exactly the same, just a little bit bigger so you can see it, but a great thing to print out and put in your exam rooms, or if you're in a nursing home setting, put it in where your medications are kept, things like that, so that everybody keeps in their mind the proper way to take a blood pressure. This is a recording log for your patients to record their blood pressures and pulse. And a lot of times people say, well, why do I need a specific log? I got a piece of paper, I'll just write it down. Well, I always go back to my diabetes educator training, and it's really hard to look at trends when somebody just brings in a piece of paper with a bunch of blood pressures on it. And so this log helps you look at the trends. It goes all across the mornings. It goes all across the evenings for a week. So you can look and see quickly, what are those blood pressures doing? So definitely worth giving your patients a log to use, so that when they do come in, it makes it that much easier for you also to enter that data into the average estimator, so that you can just put that data in there really quick before they go in to see the provider. All right, let's see. We've just talked about that one, the pre-assessment, and your device. Okay, so I wanted to make sure that we talked about all of those before I move on. So some resources today. are all going to be in the resource document. The blood pressure training video for your staff, the SMBP quick start guide that we just went over the 5 steps, the implementation toolkit, and the collaborative care models for improving hypertension control is a video that if you're working in an environment where you want to make sure that your community, maybe your senior centers, your pharmacies, sometimes there's blood pressure clinics that are done at libraries and things like that, that you're all working together in a collaborative way to make sure that communication is happening, that results from blood pressure readings are getting taken, and how that helps with the whole community wellness. We always want you to leave an action, and we know these last 4 weeks there have been a lot of information that's gone over, and I do believe Katie's going to talk about a lot of that in the office hours. But I just wanted to make sure that you remember about the Great Plains Quinn Quality Improvement Project Guide and the tools that are in that. You highly encouraged to look it over and see if it's something that you want to use to walk through conducting a quality improvement project. And no matter what stage you're in, remember starting small by identifying one issue or problem at a time is the way to be the most successful, which I think we talk about all the time. Just take small baby steps, change one thing at a time so that you can see your effect. So we're here to support and meet you where you are in that QI journey. Let us know if you need some one-on-one technical assistance. We're always glad to help. So now Katie will lead us into our office hours, and we'll be happy to answer any questions that you may have.
All right, thank you, Dee. Awesome information and easy to apply. And that's kind of what our focus is here. Just things that we think are great resources that are easy to apply to your organization. So I'm just going to open it up right now for any questions or comments. Please take yourself off mute. The poll is always open. The chat is always open. We'll get to the polling later, but anything that you would like to, if you had a success story, has anyone started a program and is it working really well, or did you come up with barriers? So anyone want to take time? If not, you guys can always put that information in at any time. I just want to highlight some key takeaways over the last 4 weeks, and thank you all for joining us on these. And so I'm just going to kind of really quickly recap, just over the weeks, the 140/90 versus the 130/80, knowing, what is considered diagnosis of hypertension and what is considered control, blood pressure screening at each outpatient encounter. I know we talked about that. Sometimes it's not always taken. Identify what blood pressure guidelines is being used at your facility. Again, everyone might be different and not support the AHA guidelines. So again, knowing what is acceptable, with your provider. And then hypertension and complication prevention, Million Heart Change Package. Again, a ton of resources that you can, glean a little bit out and apply to your organization. Other key takeaways: identifying disparities in blood pressure diagnosis and control. Very important to understand the disparate population that you serve, and disparities come in all shapes and sizes. So please review that. Engage, activate, and empower the individual. It is important to make them included in part of this plan. This isn't our plan. This isn't the provider's plan. This is the patient's plan. So again, engage and empower in the individual. And then the target BP, we really went extensively over that last week too. And, the 3 steps: the measure, act rapidly, and partner with your patient. And then target BP, as we talked about today, self-measured blood pressure, quick start guide, and then implementing in that organization that you are currently in. And just as Dee has went over some great tools, easy tools that anyone can put into play, bite-sized pieces, whatever, might work for you. So with all of that being said, here is a polling question that I am going to launch, and I want you to use this one's a little bit different. Type in your community, besides your provider, where can you get your blood pressure taken? So think about your community, and if the clinic's closed or wherever it may be, is there somewhere you can go? So if you can type in your response and hit submit, that'd be great to see. Might help others learn from what's working well and being able to put it in. I know there are some libraries. Anyone else? Walmart, great. Health nurse, public health, awesome. Local pharmacies, home monitoring, great. Drugstore, public health, home monitoring. These are all great.
Parish nurse, that's a good one.
Yeah, I know some churches are putting them in there too. So, you know, that's great that they know that that resource is available. A lot of times churches are accessible 7 days a week. So that's a great option as well. Any other ones? I know there was one that the library, I thought that was great. I even thought about in my own community how that might look, you know, and it's nice and quiet. You can read a book, go take your blood pressure, see where you're at. So thank you for the responses. That's awesome. So my next question is, what is one thing you could focus on to improve blood pressure control in your organization? So this whole last 4 weeks, again, we've been talking about so many tips and tricks and, you know, little here and little there. So I'm going to launch another poll, and I want you to kind of type in what you think that you can start within your organization, little small wins. Maybe it's just, you know, is it the self-monitoring? Is it just doing it? We talked about competencies, maybe starting a small competency within your organization. You know, are they being taken correctly? You know, there was just a lot to, and it's fine. If you haven't started one, that's great too. Blood pressure at each encounter, absolutely. Sometimes it's easy to forget those. Reinforce the rest. Yes, I think we're so quick to hurry up, take that blood pressure, and we're talking to them and asking them their medications. You know, let them take a moment to take a breather, that 5 minutes. Skills validation, wonderful. Yeah, I think from this, I hope you guys had a little bit of takeaway. Cuff size, yes, measuring. Again, we get in a hurry and we don't take the time. We just use what is available to us, and that does make a huge difference. Patient education, there we go. It is all about the patient, making sure that they're well aware what this means. What do your numbers mean? How does that affect your diet, your exercise, your medication you're currently on? So including them, empowering them, you know, partnering with them. So great responses. Thank you so much for putting those in there. And then last, we do have to make sure you head to our website, greatplainsquin.org, and register for our next series. We're pretty excited. We got more coming to you, and that will be stages for opioid misuse, and then the C. difficile, you know, and so those are really great topics for all entities that participate in our Friday Focus for Health. So as always, if there is something you feel we should probably be covering and we're missing it, you guys are the boots on the ground. We really appreciate, you know, what are the barriers, what's, you know, giving you angst within your organization, because we want to be here to help. So by all means, reach out to us, email, and if you can't find us, again, go to the website. There's a way to contact us there. And then lastly, being mindful of your time, we'll end it here with a couple minutes to spare. We want to thank you for taking your time out to attend these series. It is very important to know that, you know, we're here for you, we're here to guide, support you, and your participation is greatly appreciated. So please complete the webinar evaluation so we can continue to work together to make this time valuable. We really appreciate your feedback. I know we say that a lot, but it really does drive our mission and our values as we present them to you. So attendees will be dropped off at the evaluation at the conclusion of this call. If it's easier for you, please scan the QR code or click the link within the chat to complete the form. Again, thanks for joining. Have a wonderful weekend, and we look forward to seeing you next week as we start our new series. All right.
Just one
Yeah.
little tidbit. Our March series is not going to start until the second Friday. So that'll be the 10th of March. We've got 5 Fridays in March. So we're gonna give you a break for the first
Wow.
Friday, the 3rd, and we're starting the series on March 10th. So that will be when the next 2 topics begin.
Thanks for pointing that out. 5 Fridays. What a bonus, huh?
5 Fridays, yeah. Okay, well, thank you all very much for attending. And again, if there's anything that we can do to help you implement, get started, if you just want to bounce ideas off of us, that's what we're here for. So you can get in touch with any of us and we'll make sure that your request gets to the right person. So thank you very much.
Thank you.
Have a great weekend. Bye-bye.